Hi, this is Jerry Hesch, and this is an introduction to the workbook. This is the workbook titled The Hesch Method of Treating Sacroiliac Joint Dysfunction and Lumbopelvic Hip Pathomechanics. And the subtitle says Integrating the Sacroiliac Pelvis, Lumbar Spine, Hips, and Symphysis Pubis. The workbook introduction, I'll show you that it has a thorough table of contents. And it is 250 pages, so it's rather extensive. And then we're going to dive a little bit deeper into the workbook. I just want to show you some of the anatomical drawings, which are very nice. And we're very pleased with those. We upgraded them very recently, and there are lots of nice images. Of course, the workbook has tables. It has almost 200 photos in it. It's a very user-friendly manual, and I'm going to move forward now and show you that there is a treatment section, and it begins with some general information that gives you a nice introduction. What is the positional dysfunction? It's called inferior pubic bone, that's the title, and it describes what that means. And then it tells you what the movement dysfunction is. And then other is very worth reading. It's elaboration. It's exceptions to the rule. Then we talk about a spring test, and we have one picture with an anatomical model, and then you can see the therapist's hand, and then you can see an arrow showing the direction of force to be applied. We also demonstrate with a patient. This is the therapist. The arrow shows the direction of force. That's my hand. It's a little bit gray, but you get the concept. Patient is lying on their back. And then we talk about what is the patient position. We describe that. Then we talk about the therapist's position, especially the hand contact. And then we talk about the method of performing the spring test up here. And then we talk about treatment. So this is a treatment slide. Also, it's the same as the spring test, and it is described here. And then we talk about the retest. You do have to go back to the testing to see if it has changed or not. And then we talk about the home program. What are you going to have them do? And in this example, it's not necessary because this pattern tends to resolve with one treatment. So we elaborate and state it's seldom necessary, but then we talk about the rare exception when you would use a home program. So you can see that it's laid out very nicely, and during the seminar you don't really have to take notes because it's all laid out there for you for easy reference. And then on the next page we show you an alternate treatment technique. Same drill, patient position, therapist position, treatment, retest, home program, and then a little bit of elaboration. So you can see how nicely the workbook is laid out. And I'm not going to elaborate on all the different sections that are in the workbook. I just want to give you a very a very brief overview of the workbook. And then at the back of the workbook, we have an appendix that follows all the references, several hundreds references in this workbook. And in the appendix is a home exercise program form that they can fill out, or you can fill it out in the clinic for their compliance. And it's listed for each of the different group patterns of lumbopelvic hip movement dysfunction. And so actually, yes, this is just a continuation of that. And then there are pictures that are easy to Xerox and hand out for self-treatment for each of the different dysfunctions. And that serves as an introduction to this workbook. And thank you very much.